I need to make a confession about something that happens in every major hospital across this country every single morning. A perfectly healthy 70-year-old walks into a clinic for a routine checkup, feeling great, looking forward to watching their grandchildren grow. They get a standard blood panel drawn. 48 hours later, they are spiraling into a nightmare of new prescriptions, invasive procedures, and crushing anxiety. I see this happening constantly. The medical system often treats people over 60 simply as numbers on a spreadsheet. They run 3 specific standard blood tests because it is the standard protocol. But what they fail to understand is that your biology at 65, 75, or 85 is fundamentally different. These 3 tests are notoriously unreliable for seniors, triggering false alarms that lead to aggressive, unnecessary treatments. Treatments that come with heavy physical and mental side effects, like extreme fatigue, chronic pain, and sudden brain fog. I have watched patients lose their independence entirely, terrified of ending up bedridden or in a nursing home, not because of a disease, but because the system chased a flawed number on a lab report with heavy medications. I know you are tired of rushed 10-minute consultations where a doctor just hands you another pill without looking you in the eye. You deserve the absolute truth. The biggest threat to your autonomy is not always a sudden heart attack or stroke in your sleep. Sometimes the biggest threat is a routine test that misinterprets your aging biology as a disease that needs to be medicated. I am going to expose exactly which 3 blood tests you need to view with extreme caution. Once you know what they are, you will hold the power to stop a dangerous cascade of medical interventions before it even begins. My name is Dr. Marcus Caldwell. I am a cardiothoracic surgeon, and for the better part of my career, I have stood on the front lines in operating rooms, opening chests and holding beating human hearts in my very own hands. I have seen the devastating end results of a medical system that has lost its way, a system that prioritizes pushing prescriptions and rushing you out the door in 7 minutes flat, rather than actually listening to your concerns. I did not spend decades mastering the human body just to watch good people suffer because a rigid, outdated protocol completely ignored their individual biology. You are not a number on a lab sheet. And if you have been feeling dismissed, rushed, or ignored by the very professionals supposed to protect your health, I want you to know something right now. It is not your fault. You have done everything right, but the system is failing you. Today, we are taking your power back. I am going to show you exactly how to read these results, but the real trap actually begins long before the needle even touches your arm. You sit in that waiting room for an hour, only to be called in for a rushed 7-minute consultation. Your doctor glances at a piece of paper, sighs, and tells you that your numbers are too high. Suddenly, you're walking out with 2 new prescriptions and a heavy heart. You go home feeling like your body is failing you. But here is the absolute truth that the medical industry refuses to update. Your body is not failing. The reference ranges on that lab report are failing you. The common enemy we are fighting here is not your age, and it is certainly not your genetics. The real enemy is a set of dangerously outdated medical guidelines that were designed decades ago, mostly tested on men in their 30s and 40s, and are now being blindly applied to men and women in their 70s and 80s. The system operates on a factory line mentality. When you only have 7 minutes per patient, you cannot treat the whole person. You can only treat the numbers on a page. And when those outdated guidelines say your numbers are slightly elevated, the system flags you as sick. Why? Because the modern healthcare machine is fundamentally built on a model of money over health. It is highly profitable to lower the threshold of what is considered normal. By simply changing a guideline, millions of perfectly healthy seniors are instantly reclassified as patients who need lifelong medication. They hand you a pill to fix a number, but they don't tell you about the physical and mental side effects waiting for you. They don't warn you about the severe brain fog, the extreme fatigue that keeps you in a chair all day, or the chronic muscle aches that make playing with your grandchildren feel like a chore. If you have been feeling exhausted, confused, or terrified of losing your independence because of the medications you've been put on, I need you to hear me clearly right now. You did nothing wrong. You trusted the professionals. You followed the rules. You took the pills you were handed because you wanted to protect your health and stay out of a nursing home. You did everything right, but the system completely failed you. It treated you like a statistic instead of a human being with a unique, changing biology. You are tired of being ignored and treated like you don't understand your own body. I know you just want honest answers. You want a doctor to explain the root cause of the problem instead of just numbing the symptoms. I'm validating your frustration right now because your instincts have been right all along. You have felt that something was off when you took those medications and your body was trying to tell you the truth. We are going to stop this cycle of fear and dependency today. You are going to take the reins of your own health, and it starts with understanding exactly what is happening inside your blood vessels as you age. Because once you see how your biology actually works after 60, you'll realize exactly why those 3 blood tests are giving your doctor a completely false picture of your health.
Let us talk about what is actually happening inside your chest, your vessels, and your cells right now. When you cross the threshold of 60, your biology undergoes a profound and beautiful transformation. You are not decaying, you are adapting. But the medical textbooks sitting on your doctor's desk treat a 70-year-old body exactly the same as a 30-year-old body. This is a fundamental biological error. Think about your blood. In your 30s, your blood is carrying nutrients and oxygen in a very specific, aggressive environment. But as you gracefully age, your body deliberately changes the composition of your blood to protect your brain, your heart, and your nervous system. For example, let us look at the first test that always causes panic, which is your total cholesterol. The system tells you that anything over a certain flat number is an absolute emergency. They want to crush that number down artificially. But what they fail to explain in that rushed 7-minute visit is that your brain is largely made of fat and cholesterol. As you get older, your body naturally elevates certain lipid levels to coat your nerve endings, to maintain your memory, and to prevent cognitive decline. It is a protective shield. When you forcefully strip that away because a piece of paper flagged it in red ink, you are not necessarily preventing a heart attack. You are potentially starving your brain of the exact fuel it needs to keep your memories intact and your mind sharp. This is where the severe brain fog and extreme fatigue come from. Your body is screaming for its protective layers back. The second test they weaponize against you involves your blood sugar markers. Yes, chronically high blood sugar is dangerous, but as we age, our cells naturally develop a slight resistance to insulin as a survival mechanism. Your body is trying to keep more energy readily available in your bloodstream to fuel your immune system and heal tissue. When a doctor panics over a minor elevation and prescribes a heavy medication to hammer your blood sugar down, they risk dropping it too low. Do you know what happens when your blood sugar drops dangerously low in your sleep? That is the silent threat that causes sudden nocturnal cardiovascular events. The very medicine meant to protect you becomes the exact tragedy you are trying to avoid. And the third test, the kidney function and electrolyte panels, are often tied to your blood pressure management. They measure sodium and potassium and tell you to eliminate all salt. But your heart runs on an electrical current. I've held beating hearts in my hands, and I can tell you that the electrical rhythm that keeps you alive requires sodium. When you restrict it completely based on an outdated lab parameter, your blood volume drops. Your heart has to work twice as hard just to pump, and you feel dizzy every time you stand up. That dizziness is what leads to falls, broken hips, and the sudden loss of independence you fear the most. Let me paint a picture for you so you can clearly see how your body is actually operating right now. Think of your cardiovascular system like a magnificent ancient river that has carved its way through a canyon over 70 years. In its early days, the river flowed fast and straight, eroding the stone aggressively. But over decades, the riverbed widens, the flow becomes slower, richer, and more deliberate to nourish the deep roots of the ancient trees along the banks. If an engineer came along and looked at that slow, majestic river and said it was flowing too slowly compared to a narrow mountain stream, and then tried to dynamite the canyon to speed it up, they would destroy the entire ecosystem. That is exactly what we do when we artificially manipulate your senior blood chemistry to match a 30-year-old's lab report. We dynamite the river. A landmark study published recently by leading geriatric researchers looked at tens of thousands of seniors over the age of 70. The researchers found something that shocked the conventional medical establishment. The seniors with slightly elevated cholesterol levels actually demonstrated better cognitive function, lower rates of severe infection, and lived longer, more independent lives than those whose levels were aggressively pushed down by heavy pharmaceuticals. The study proved what your body already knows. A slightly higher number often is your biology's way of building a fortress against the physical stress of aging. Your body is incredibly intelligent. It is not making mistakes. When your lab numbers shift slightly as you pass 65, it's an adaptation, not an automatic disease. But because your doctor only has 7 minutes to look at a printout, they don't see the majestic river. They just see a red flag on a spreadsheet. They prescribe a pill to fix the paper, completely ignoring the catastrophic effects it will have on your daily life, your energy, and your independence. We have to break this cycle. You don't have to live in fear of your next blood test. You don't have to accept chronic muscle pain and memory loss as a normal part of getting older. You have the right to demand care that respects your age and your unique physiology. You just need to know how to support your body's natural defenses instead of fighting them with synthetic chemicals. And that brings us to the most important part of our conversation today. There are specific, natural actions you can take right now in the comfort of your own home to balance your blood chemistry safely. These are simple biological triggers that require no prescriptions, no expensive copays, and absolutely zero toxic side effects. Once you start using these techniques, you will change the entire conversation with your doctor at your next visit. You do not have to be a victim of a rushed system that hands out prescriptions like candy. You do not have to accept that cognitive decline, extreme fatigue, and the terrifying loss of your independence are just normal parts of aging. They are not. You have the power to protect your body, and you do not need an expensive medical degree to do it. You just need to understand how to speak your body's language. Today, I am giving you 4 specific, highly effective steps you can start implementing right now. These are natural and simple solutions that cost absolutely nothing. They are designed to support your senior biology, manage your numbers naturally, and keep you out of that hospital bed. Step 1 is a technique you can perform while sitting quietly in your favorite chair. It is a 60-second trick that directly impacts your blood pressure without a single chemical entering your bloodstream. It is called isometric hand grip training. When you clench your fists or hold a towel tightly in your hands for 60 seconds and then slowly release, you are creating a localized, temporary restriction of blood flow. When you let go, your body responds by flooding your vessels with a powerful molecule called nitric oxide. This is a natural vasodilator. It signals the smooth muscle tissue lining your arteries to relax and widen. By simply holding your hand tightly for 60 seconds twice a day, you are actively training your arteries to remain flexible. You are lowering the pressure against your vessel walls safely and naturally, replacing the need for aggressive medications that leave you dizzy and confused. Step 2 must happen the very second you wake up, before your feet ever touch the floor.
We know that the early morning hours are a highly vulnerable time, and the fear of sudden cardiovascular events right after waking is a heavy burden to carry. This vulnerability happens because your body spikes cortisol to wake you up, causing your blood vessels to constrict while your blood is still thick from a night of rest. Jumping straight out of bed forces your heart to work incredibly hard in an instant. Instead, I want you to use a specific breathing technique to command your nervous system. Lie flat, inhale deeply through your nose for 4 slow seconds, hold that breath for 4 seconds, and exhale very slowly through pursed lips for 6 seconds. Do this exactly 5 times. This specific breathing technique stimulates your vagus nerve, which acts as the master brake pedal for your heart. It neutralizes the morning cortisol spike, smoothly stabilizes your blood pressure, and prepares your heart for the day safely. Step 3 is about protecting your evenings and guaranteeing your body repairs itself overnight. Stop relying on chemical sleep aids that leave you with severe brain fog the next day. Instead, introduce a specific natural tea into your nightly routine. Brewing a strong cup of hibiscus or chamomile tea 1 hour before sleep is a profound biological intervention. These teas contain powerful flavonoids and antioxidants that act similarly to mild, natural ACE inhibitors. They gently coax your nervous system out of the anxious fight-or-flight state and lower the resistance in your blood vessels while you rest. This simple nightly ritual ensures that your heart does not have to fight against rigid, constricted arteries while you sleep. You are creating a peaceful, healing environment for your cardiovascular system using nothing but a warm, natural plant extract. Step 4 involves a mechanical adjustment to your sleeping position. The way you align your body for 8 hours directly impacts your cardiac workload. I want you to make a conscious effort to sleep on your left side. Let me explain the anatomy. Your aorta, the largest and most important artery pumping oxygen-rich blood away from your heart, naturally arches to the left side of your body. When you sleep on your left side, you are brilliantly working with gravity instead of forcing your heart to pump against it. You are facilitating optimal venous return, allowing blood to flow back to your heart with minimal effort. This sleeping position is a zero-cost, highly effective way to reduce the physical stress on your heart muscle every single night. The science behind why these 4 steps work is undeniable. You are not fighting your biology with toxic chemicals, you are supporting it. You are giving your body the exact mechanical and chemical signals it needs to heal, to relax, and to function at its absolute best. This is how you prioritize your quality of life over just surviving another day in a medicated haze. You want to live with dignity and autonomy, and that requires taking the reins of your own health. This is about true power and control. The next time you sit in that doctor's office and they look at a piece of paper and tell you that your numbers from those 3 standard blood tests are slightly off, you will not be paralyzed by fear. You will not immediately accept a prescription that threatens to put you in a wheelchair. You will pull out a pen, look your doctor in the eye, and advocate for yourself. You will demand that they explain the root cause of the issue, not just treat the symptom. You will confidently ask your doctor if this new pill is absolutely necessary, or if you can continue utilizing these powerful natural techniques to manage your health safely. You know the knowledge now. You have the tools to reverse the damage and protect your independence. But knowing what to do is only the beginning. If you truly want to survive the modern medical machine, you must know exactly what to say when a rush doctor tries to intimidate you into compliance.
I need you to do something for me right now. Go down to the comments and share your experience with us. Tell me, what was your systolic pressure the last time they checked it? Or how many medications are currently sitting on your nightstand? Write it down. I read these comments, and this community is here to validate what you are going through.
You are not alone in this fight. But more importantly, I am asking you, I am practically begging you to share this video with a spouse or a friend over 60. Send it to your sister or email it to that neighbor who is constantly exhausted and thinks it is just part of getting older. They need to hear this truth before they agree to another prescription or procedure that they might not actually need. You could literally save their independence today just by sharing this message, creating a true sense of public utility. We have covered how to protect yourself from these 3 toxic blood tests and the cascade of medications that follow. But there is another silent threat lurking in your daily routine, something you probably do every single morning that is secretly putting your heart at massive risk. You need to know what it is so you can stop doing it tomorrow. I have put a video right here on the screen that exposes exactly what this morning habit is and how to fix it effortlessly. Click or tap that video right now. Your heart will thank you. I will see you over there.